Welcome to the office.
Tell us how you're doing.
Much better than before.
10% better?
No, I'd say about 80.
Oh wow. In terms of the pain or mobility?
Kind of both.
Okay.
Yeah, both. I had last Wednesday I woke up and for the first time, I was in no pain. Usually I wake up and I'm stiff and a little bit sore, but my legs just felt like really good. I don't know. There was no pain, no distraction in none of the nerves or anything.
Okay.
But then on Thursday came and I got a little bit stiff again. But okay. Wednesday, I'm telling you, I just walked around like 20 years ago again.
Nice.
And so, but yesterday, I don't know what or why.
It wants to go back, Larry. Remember this.
Yeah.
And your wife is on the side over here so she can hear this as well. So let's say this is where we want to be. This is where we're at. And we make the adjustment. We get it closer to where it wants to be. Mm-hmm. Those ligaments have been like that for a long time. So they want to naturally go back. Mm-hmm. And that's why, number one, we keep on it in the beginning. That's why I'm seeing those first few visits in a short time.
Right.
Number one. And number two, that's why the walking is so important.
Yeah.
And the more walking, the better this stuff comes around. Okay? Mm-hmm. So he needs to walk 12 to 15,000 steps a day. Mm. Okay, anything new show up? Any new crack, kink?
No, it always cracks during the day whenever I stretch, but just pain-wise, that's the big thing. It's a lot better. My mobility is better, and I'm just hoping that it continues on that track over time.
Okay.
Yeah.
Have a seat center on the chair for me. Let's see where we're at today. And one thing interesting in Larry's case is that he has some hardware in his neck. And that hardware, we went over, C2, 3, 4, and 5 are fused, and 6 and 7 are fused. If C7 shows up, I can deal with it. T1, I can deal with it. C3 and above, I can deal with that too. Obviously, the segments that are fused, there's nothing we're going to do for those, right?
Right.
Okay, starting at the base of the neck. Today we're getting a 4-pointer, C7, very nice. So ma'am, this meter reads 25 points. It's a heat meter. It's measuring left to right side. The bigger the number, the more inflammation there is. And
it actually measures temperature?
Yes, it's a bilateral temperature differential.
Oh.
So it's measuring temperature, and these increments here on the scope are 8/10 or 4/5 of a degree. So if we go to 5 points right here, then 5 times 4/5 is what? 4 degrees. There's a 4-degree difference in temperature.
Wow.
T4, 5 points. Good. Let's see how that low back is doing. You think your wife's going to be able to handle seeing what we do to you?
Oh, yeah.
Yeah. We make it an encore. Hold on. So down low, everything has been reduced, Larry. Down low, we're at 4 points too. Very good.
So then why yesterday was I a little bit, well, it's trying to come back, but it was actually a little bit stiff down there, but yet it's still reading okay? Is that
I'm reading nerve, not ligament, right? So the stiffness is just tight ligament.
Ligaments, okay.
Yes. Stanford did a study many years ago, and the result or the outcome is your body will acquire the position it's most in within a 5 to 10 year period. So if you're like this for 5 years, this is how you're going to be. If you're sleeping on your stomach for 5 years, turning your head to one side, you're going to have a twisted spine all the way down to L1. Stomach sleepers, no bueno.
Right there.
Yes, sir. He's right there.
You know where it's at, don't you?
And, well, that's my job, right? That's my job. My job is to know where it's at. And the other part is to accept it. 2, 3, 4. That's 5, Larry.
Yeah.
That's 4. 5.
I'd say 5 is a little bit worse than 4.
They're both tender.
Yeah,
5
they
is
are.
a little bit more. 5. Something interesting today. We got something good today. It's going to be a little spicy today, sir. Okay.
You know my motto, go gorilla.
Oh, like the gorilla goo? The
No,
gorilla
that-
glue?
No, then it'll stick in. Well, if it sticks in the right spot, that's
There
okay.
you go. And we go in gorilla. Don't help me too much, sir, please.
It sounds like
I like that.
It sounds like tinfoil.
Yeah, but I like that. That scar tissue is breaking up.
Oh, is that what it is?
Yes. Nice.
That's what it sounds like.
Nice and easy, sir. C7. C7. You're doing good there. It's already wanting to go. Look. Up and down. Up. Ooh. Nope.
It went the first time.
Did it?
That little cunk.
I'm sorry, I didn't feel it.
No, the first time you just moved it, it went
It went a
conked.
little clunk, yeah.
Yeah.
Let's go face down, sir, on the high-low. Let's go face down, sir, on the high-low.
Okay, on this one.
Yes, sir.
Okay.
We're going to do T5 here, but that low back is going on the knee chest table today.
Oh, good.
All right. Let's go face down, please.
I'm ready for it.
Yes, sir. And remember that segment on L5, the articular pillar and superior articulating pillar of sacrum and the inferior articulating pillar of 5 is got a lot of calcium in there. 1, 2, 3, 4, 5. A little bit more. Gotcha. Nice. Good job, Larry.
That was a good one. It didn't even hurt.
Nice. Come off slowly.
Okay.
I'll have you walk it off twice. And then I'm going to show you the knee chest table, how to get on it. Good stuff.
There's once.
All right. One more time. L5, we're going to set that as a PRI-M. All right, let's do this. Tummy all the way up so I can get my contact. Right there. And the contact, ooh, you can actually feel that. Right there.
I can feel it just moving up and down.
Yes, sir. Tummy all the way down, sir. Good. All the way down, brother. Good. And that's part 1. Nice. Come up slowly, please.
That was a big kunk.
Yes. A kunk, not a crack.
Yeah, that was a kunk.
Cracks are like joint farts.
That went
We
deep.
like to go clunk. Exactly. Let's walk that off.
Oh.
It's gonna feel a little weird.
It does feel bigger. Yeah.
Do this. Hold on to my hand and let's do this. Knees up high, knees up high. Awesome. And let's walk it off one more time, please. And that's what Larry does here, man.
Wow,
Yeah.
not too bad.
It's not all it's cracked up to be.
Ha 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 ha. Larry,
No, it is what it's cracked up to be.
You've been adjusted before too, right?
Many times. But not the way you do it.
So what's different? I mean, obviously I don't know what's different because I don't know what I'm doing to you. I know what I'm doing to you, but I don't know what it feels like.
Well, I've been to chiropractors kind of my whole life. It's been part of our budget.
Okay.
But you know, I go to other chiropractors and it's always the same. They do the same 5 or 6 or 7 moves, and then with you just deal with 3 or 4 joints, and and it's almost like it's an instant. You notice it instantly. It doesn't take you weeks or months to get results.
Interesting.
Yeah.
Larry, you made an interesting comment, 3-4. It's whatever I find, right?
Yeah.
But Dr. Gonstead actually said this, and he says, when you're looking at for nerve pressure, and if we're going to suspect a neuritis first, there's only going to be 3 to 4 majors in the body. The rest is compensation. Come over here. Check this out. He's all clear. Neck is clear. 5 is clear. L5 is clear. That was beautiful. Come back slowly. Check this out. What?
Well, that's not as bad.
Okay, let's do the machine. All right, let's do the shoulder. Let me do the work. Don't help. Don't help. Let me do the work. Don't help. There you go. On your back, please, over here. Raise your right leg, please. Down. Raise your left leg, please. And the other thing I would suggest, if you have a bicycle,
We do.
put it against the wall, and I'd like him to be pedaling backwards 5-10 minutes a day. Great for his knees. It's going to help get some of this swelling out. And when I need to get to this, it'll be easier.
Okay, good.
Okay?
Yeah.
Easy stuff. Backwards pedaling, no resistance.
He has been doing that actually.
Yeah, he listens. Come on up there. Very good. Stand up. Let's check the hands. Right over here, please. Questions for me?
Is there? Well, there's nothing I can do to speed up the process. It just has to.
That's
happen.
nature's healing principle,
Okay,
not
all
mine.
right. I always want to do things to.
You're doing everything.
Yeah.
Okay, you're
Yeah.
doing all the right things.
Yeah.
Okay?
Okay. Got it. Thank you so much.
You're very welcome.
Yeah.
Have a wonderful weekend.
I've come a long way in a short amount of time.
It's been about a week, right?
Yeah, week and a half. Yeah,
Yeah.
amazing.
Right now. I appreciate it.
I've been laid up since last October, kind of really in pain till now. Yeah, so thank you.
You're welcome.
All right.
Take care. God bless.